Imagine a world where a doctor claims to have found a breakthrough in the fight against cancer, something the medical establishment refuses to acknowledge. Dr. Burzynski is that man. His work has sparked both hope and controversy, battling the FDA and the traditional medical community for decades. But is he a pioneer being silenced or a defiant maverick challenging the system? In the 1970s, after immigrating to the United States from Poland, Dr. Burzynski embarked on groundbreaking research that would define his career. He identified a group of peptides and amino acid derivatives in human blood and urine, which he named anti-neoplastins. He theorized that these compounds played a crucial role in the body's natural defenses against cancer by helping to regulate the abnormal growth of cancer cells. Convinced that cancer patients lacked these vital substances, Burzynski set out to develop a synthetic version of anti-neoplastins, hoping it would become a revolutionary treatment for various types of cancer. But what exactly are anti-neoplastins, and how do they work in treating cancer?
They will run the analysis on the entire cancerous genome of 24,000 genes. We are not treating, for instance, quote-unquote, large cell lung cancer. We are treating the combination of genes which are causing this cancer.
Anti-neoplastins are naturally occurring peptides. They are compounds designed to specifically target and regulate cancer cells while leaving normal cells unharmed. The idea is that these compounds correct abnormalities in gene expression, which are responsible for the uncontrolled growth of cancer cells. In case you didn't know, there is no set cure for cancer because there is many different types and stages that would require different approaches. Burzynski's treatment typically involves administering anti-neoplastins, either through injections or oral formulations, tailored to the cancer's type and stage. Anti-neoplastins are designed to offer a targeted approach to cancer treatment by addressing the genetic mechanisms that drive cancer cell growth and replication. Unlike traditional chemotherapy, they are believed to be non-toxic, minimizing harm to healthy cells while focusing on cancer cells. Dr. Burzynski's treatment method is also personalized, adjusting the anti-neoplastin therapy based on each patient's unique genetic makeup to better suit their specific condition.
And then my doctor called me and said, "There's no tumor." Can you believe how 3 months? It's not even less than 3 months. And my tumor was gone. And just 3 months earlier, I was saying it was all over.
The fact that we got rid of his cancer at this time is great, okay? But obviously, this would be criticized by standard oncology because they would say, well, this patient should receive standard of care, which means surgery, then combination of chemotherapy.
The timeline of this treatment began in 1977 when Dr. Burzynski started using anti-neoplastins on patients at his Houston clinic, despite lacking FDA approval. By the 1980s, his work drew attention, but also scrutiny from the FDA and oncologists due to the absence of formal trials. In the 1990s, Burzynski faced legal battles as the FDA sought to shut down his clinic. He defended his right to treat patients, especially those with no other options. In 1994, the FDA approved Phase 2 clinical trials under strict oversight. Interest in Burzynski grew in 2010 with the release of a documentary that portrayed him as a pioneering figure challenging the medical establishment. Some of the treatments included aggressive brain tumors, like glioblastoma and medulloblastoma, as well as lymphomas, breast cancer, prostate cancer, and lung cancer. His work gained particular attention for addressing terminal or inoperable brain tumors, where conventional treatments were often ineffective. These cases became central to his practice, highlighting the potential of his approach for patients facing limited options. But don't just take my word for it. There are numerous testimonials from patients who credit Dr. Burzynski's anti-neoplastin therapy for life-changing results.
The doctors were very shocked because the biopsy revealed Laura's tumour had progressed from a grade 1 or 2 to now be a grade 4 glioblastoma, multiform. We were in this category of this is terminal. and Laura may not have
Many months.
months, rather not even a year. I don't know.
This grey patch is a low-grade cancer which is affecting her balance and her coordination. But doctors are much more concerned by this small white area, which is an aggressive form of cancer and has appeared in just the last 3 months.
An independently conducted MRI by her local radiologist reveals Laura's tumor to have diminished by 77%.
Another patient was Hannah Bradley, featured in the Burzynski Cancer is Serious Business documentary, reported to have noticed a significant tumor reduction after undergoing the therapy. Despite these success stories, many oncologists and medical organizations remain skeptical. Burzynski's supporters suggest that the multi-billion-dollar cancer industry might resist recognizing a potential cure. If proven effective, it could threaten the foundations of conventional treatments. Dr. Burzynski remains a polarizing figure, still operating his clinic in Houston, despite decades of legal battles with the FDA and Texas Medical Board. His treatments are controversial and costly. They are often sought by patients desperate for alternatives. Critics highlight the lack of peer-reviewed research and the high fees, accusing Burzynski of exploiting the vulnerable. Yet his loyal supporters and patient advocates paint a different picture. A doctor battling against a powerful system and fueling debate on whether his ongoing trials are the real deal or just another false hope. Is Burzynski a misunderstood visionary, or is he merely profiting from false hope? Or worse, what if he's right, and they're actively suppressing the truth to keep it from reaching the public? Could there be more to this story than meets the eye?